Hi, my name is Caitlin Hunick, and I graduated from the Physical Therapist Assistant Program at Southeast Community College in 2014. I currently work at Husker Rehab and Wellness in Beatrice, Nebraska. It is an outpatient clinic that sees a wide variety of patients ranging in age from 8 to 98. And we see a wide variety of cases such as post-op, chronic pain, postural issues, just about a little bit of everything. I feel that my strengths as a PTA are my communication skills. I'm very good at making sure everybody on our team, the other PTAs, physical therapists, we even have an occupational therapist who sees some of our patients that we see in PT. Just making sure everybody's on the same page and knows everybody's current situation just helps things flow a lot easier. I feel that I am very patient with all of my patients and try to be as understanding as I can and know that not everybody is the same. We may have two patients that both have had rotator cuff surgery, but they may progress totally different. One may progress quicker than the other, and just being patient and taking your time with each case and making sure everybody gets your full attention. I feel that my weaknesses as a PTA are that sometimes I may be timid and unsure of whether it's the right time to progress somebody, and I just want some reassurance from the PT to make sure I know that what I'm doing is correct, even though I know I've had the training that I need to be able to make these decisions on my own. Sometimes I'm just a little timid and hesitant in making them. And I feel that my other weakness is that at times I can almost be too nice to the patients and not give them some of the feedback they need. I like to make sure that I let everybody know all the positive things and how well they're doing, but at times I do have trouble giving them that kind of negative feedback and let them know that they need to be progressing a little more and we need to be trying to increase that resistance and not always letting them get off easy and just do the same thing every time. An acronym that best describes me is REAL. I am reliable. I am very committed to my job and to my patients, and I feel like that it is very important to be on time for your patient's sake so that you can keep things flowing throughout the day. And I feel like it's also important to show that you can be on time and hope that your patients give you the same respect and that they are on time to keep things flowing. E is ethics. I feel that it is very important to be ethical in your job, especially in the many settings that PTAs can work in. It's very easy to talk to somebody you know about a patient, especially in a smaller town, but keeping good ethics and good morals and knowing that you can't just talk to anybody about a certain person is very important to keep in mind. I am adaptable. It is very easy to come in and do the same thing and progress each patient the same way, but some days they may come in more pain or may not be doing as well, so you just have to adapt to that situation and progress them accordingly, or you may have to possibly not do as many exercises that day and just take their needs into consideration. And L is for loyal. I feel like it's very important to be loyal to your patients and gain your patients' trust so that they can confide in you in anything, whether it be therapy related or outside concerns, because sometimes those concerns can play a big role in that patient's visit that day. So it is very important for them to know that they can trust you and that you are a loyal person that they can confide in. So our patient today has come in with back pain for the last 5 or 6 months, and he says that it is mainly on his left side, but has also started to go over to his right side. When the physical therapist did the initial evaluation, they found that his left hip was anteriorly rotated. So what we're going to start with today is called the 90-90 hip lift, and that's going to help set his pelvis back to neutral, and it's also going to use some diaphragmatic breathing to help maintain that neutral pelvis. So we'll go ahead and have our patient lay on the ground, and if they're in the clinic, we usually have them on the table and have a chair up on the table for them to place their feet on, just because we don't want them pushing into a wall, because then that doesn't maintain that 90-90 position. So I'm going to go ahead and adjust his feet a little bit just so that he's in that 90-90 position to start with. I'm going to have you scoot your hips down towards the couch a little bit for me. Okay, so he's in that 90-90 position. The next thing you're going to have them do is dig their heels into the couch or whatever they're using at home. They may use an ottoman if they don't want to use their couch. This is going to engage the hamstrings. And then you're going to have them do a posterior pelvic tilt. So you're going to have them tilt that pelvis so that it's flat on the ground. And then you're going to have them lift their hips up just an inch off the ground. While they're holding that, you're going to have them breathe in through their nose and deep breath out through their mouth. And when they breathe out, they should completely exhale out so that it's almost like they're dropping off the edge of a cliff when they get to the end of their breath. And then you'll have them do that again. And breathe out. And one more time. And back out. And he can go ahead and relax. We typically have people do 3 breaths and relax, and then we have them engage everything again and do 5 total sets. My 4-week course would be about rhabdomyolysis, which is when the muscle breaks down and releases a protein into the bloodstream that can cause severe problems such as kidney failure. And each week we would discuss a different patient type, a different setting, and what led them to this diagnosis. And we would have lecture each week and open group discussion and hands-on lab experience so that we could see how the therapists would deal with these different situations, such as an 80-year-old elderly woman who had fallen and laid there for a couple hours before anybody found her and was diagnosed with rhabdo, versus a 30-year-old male who has been doing CrossFit for the last few years and overexerted himself at a session and was diagnosed with rhabdomyolysis. The way I would test the people in my class would be through patient simulation. We would give them a certain patient type and how they came up with the diagnosis. Like I said, whether the patient was the 80-year-old woman that had laid there for a while and had some of that muscle cell death, and how they would progress that patient. One of the things with rhabdo that is very important is making sure when you're progressing them that you are not overexerting that patient again, because the muscle cell has already broken down and we don't want to keep overexerting those muscles and keep destroying the muscle tone and the cells that they already have. So that would be one key thing to focus on when I was testing the therapists in my class, to make sure that they really get that point and not overexerting the patients and making sure those patients stay healthy while they are seeing them in therapy. I have been a PTA for 3 years now and have loved every minute of it. When I heard about the bachelor's program at Clarkson College, I knew that it was something that I had to do, and I have always had a passion for increasing my knowledge about this field and felt that this was the perfect way to do that and to be able to serve my patients' needs better. And I just feel like it's a great opportunity for any PTA out there to just gain more knowledge and insight about the field, because coming out of the associate's program, you do learn a lot, but there's so many things that you just are unaware of, and I feel with this bachelor's degree, it's just going to help give me that useful information that I need to be able to further my career. And I look forward to meeting all of the Clarkson faculty and staff in the coming months. Thank you for your time.